A heart attack is a frightening experience. If you have experienced a heart attack or are close with someone who has, you should know this: you are not alone. In fact, tens of thousands of people survive heart attacks and go on to lead productive, enjoyable lives. Today, we will tell you what happens during a heart attack. 4. What happens during a heart attack? There are major and minor heart attacks. Major heart attacks usually occur when a sudden clot develops in a vessel that's partially obstructed. The vessel goes from open with good flow to closed. The muscle fed by that vessel then begins to die, which causes major heart muscle damage. That muscle damage causes pain, though some have silent heart attacks with no pain, as muscle dies and turns into scar tissue. When you have a heart attack, you are prone to rhythm disturbances. A person can die as a result of a heart rhythm gone haywire. The heart doesn't necessarily stop with every heart attack, but it can. Minor heart attacks occur when vessels with critical chronic obstruction are placed under certain circumstances where the muscle is demanding more blood flow than it can receive. This also results in muscle damage. A minor heart attack is not necessarily life-threatening. 3. What causes a sudden blockage to occur? We don't entirely know. Sudden blockages can happen because certain plaques may be metabolically active at times, which means they attract platelets in bloodstream that induce blood clots. The plaque is unstable and attracts the blood elements that initiate a clot. Genetics also play a role. Aside from hereditary factors, blood pressure, cholesterol levels, tobacco, and diabetes play a role. But there is a lot more that we don't know than what we do. Some people have no risk factors and still have coronary blockages. 2. What are the symptoms of a heart attack? People often confuse heartburn with a heart attack. But a person should never ignore pain in the chest, pain in the arm, dizziness, lightheadedness, palpitations, or a fluttering sensation in the chest, or a decrease in exercise tolerance. A lot of times in the spring, people go out to cut their grass and notice they're short of breath. 1. What do you tell people to do for prevention? Quit smoking, know your numbers, keep blood pressure and diabetes under control, achieve a healthy weight, exercise, and pay attention to cholesterol, especially if you have a family history. In general, there are many things that you can do that may prevent a heart attack. However, some factors beyond your control, especially your family history, can still lead to a heart attack despite your best efforts. Still, reducing your risk can postpone when you have a heart attack and reduce the severity if you have one. Although there are several risk factors that you can't control, there are many ways you can help yourself and reduce your risk of a heart attack. These include: schedule a checkup. Find a primary care provider and see them at least once a year for a checkup or wellness visit. An annual checkup can catch many of the early warning signs of heart disease, including signs that you can't feel. These include your blood pressure, blood sugar levels, cholesterol levels, and more. Quit tobacco products. This includes smokeless tobacco and all vaping products. Exercise regularly. Aim to 20 to 30 minutes of moderately intense physical exercise once a week. Eat a healthy diet. Examples include the Mediterranean or DASH diets. A plant-based diet approach is an excellent alternative. Your primary care provider can advise you on a healthy goal weight and provide you resources and guidance to help you reach that goal. Manage your existing health conditions. This includes high cholesterol levels, high blood pressure, and diabetes. Reduce your stress. Consider techniques such as yoga, deep breathing, and meditation. Take your medications. Don't just take medications when you remember to or when you have a doctor's appointment coming up. Keep all your medical appointments. Seeing your healthcare providers regularly can help uncover heart-related issues or other medical problems you didn't know you had. This can also help treat problems sooner rather than later. Do let us know in the comments if anyone around you has experienced a heart attack. Thanks for watching.